everyone, welcome back to my channel. Thanks for watching. My name is Deanna Tikhonov and I'm a women's health nurse practitioner, and on this episode I'm going to be talking to you guys about the IUDs. So, as I've talked about before, there's a ton of different birth control methods out there, and unfortunately there's a lot of stuff that's just not really true. I have patients all the time Googling things, getting extreme scenarios that are like 1 in a million that it will actually occur, and then that gets into their heads and then they're worried and scared, and I totally understand. We've all been subject to Googling things and letting that get the best of us, but I really wanted to help teach you guys what the IUD actually is and dispel any myths, and that way you can make an informed decision when you're deciding on what birth control method to use. So I do have 2 samples here of IUDs. I just want to do a disclaimer. I have no affiliation whatsoever with any brands. I'm not going to be speaking about the specific brands, but just the types of IUDs. So the first kind of IUD is a non-hormonal IUD. This one right here, it's made of copper and it is effective for up to 10 years in the US. It's 99% effective against pregnancy, and you can take it out at any time. It doesn't have to stay in the full 10 years, but it is effective for up to 10 years. Now with the copper IUD, the way it works is sperm cannot live in the environment of copper, so they just basically die off. So that is how it's working to prevent pregnancy. As far as how it affects your periods, is your periods will continue every month, and for some women your periods may become more heavier with more cramping. So this probably isn't the best method. If you already have a history of heavy periods and painful periods, then the copper IUD can make that a lot worse for you. So it probably would not be the best choice. If your periods are overall normal for you, tolerable, nothing too painful, nothing too heavy, then you could, you would be a candidate for the non-hormonal IUD. So the other type of IUD is called a progesterone only IUD. So this is just one of them. There's a few different ones out on the market. So this is what it looks like. So as far as you see here, the shape is exactly the same. They're both T's. However, the size is slightly different. So the copper IUD is slightly larger than the progesterone only IUDs, and then within the progesterone only IUDs there's a few different sizes. So with the progesterone IUDs, in a nutshell, just to kind of do an overview, is that there is a hormone in the IUD called progesterone that's being released locally inside your uterus. So every day a little bit of the hormone is being released inside your uterus, which thins the lining of the uterus. It's altering it inside. And why that's important is because that's how it's affecting and preventing pregnancy. And what it tends to do with time is it tends to lighten women's periods. It could make them less crampy, less painful, less heavy, and depending on which IUD you pick, there is a possibility of your periods completely going away. Now I have the question all the time, is that normal? Is that healthy? That seems weird. I should have a period every month, and that's a great question. So if you are not getting a period and you're not on any birth control method and we don't really know why you don't get periods, that is not normal, and that's really important to be investigated further. However, there are different birth control methods that can stop your period, and that's actually okay. It's safe from a hormonal standpoint, from a medical standpoint, and it's not a problem. It's also something I like to clarify is it's not that if you stop getting your periods that there's a buildup inside that has not been released. That's not what's happening, because like I said, the way the progesterone is working is it's thinning the lining inside your uterus. So there's not as much to shed each month, which is why your periods will tend to get lighter and could eventually stop depending on which one you pick. Now, the progesterone IUDs are effective between 3 and 5 years, depending on which one you pick in the US. I say that because in other countries, some of these methods are FDA approved for longer periods of time, but in the US, it's effective between 3 and 5 years, depending on the one that you pick. As far as each one, they all affect your periods a little bit differently. So when you're deciding between which IUDs to pick, it's important to think for yourself of what personally do you like about your period or not like about your period. There are women that like having a period every month. It's reassuring. They They like knowing that they're getting their cycle. There are other women that if you told them they never had to have a period again, they'd say, sign me up. And it's okay. There's no wrong or right answer. Both are totally acceptable feelings to have. And that is really important to just kind of reflect on yourself of which one you'd fall into. Or are you like, hey, I just want them to be a little lighter. I'd still like them every month, but if they could be lighter and shorter, that would be great. So that really helps to decide which IUD might be the best one for you. I do encourage to not focus so much on the amount of years that you'll have it. You know, if you say, oh, well, I know I'm gonna want to have children in 3 years, so why would I get an IUD that's for 10 years? And that's not really, it's not so important of the amount of time as it is of your personal preferences and what's the safest option as well. So with safety, so basically most people could be candidates for either IUD, but why would somebody pick the non-hormonal versus the hormonal IUD? So there are certain medical conditions that I've talked about in other videos that you cannot have any hormones inside of your body. So for example, women who have a history of breast cancer, different kinds of cancers, it's not a good idea to be introducing more hormones inside the body. So any history of cancers, not the best candidate for the progesterone IUD. And for some women, it's just a matter of they don't want to have any hormones inside their body. If you have strong feelings about putting any hormones inside your body and you'd rather do a non-hormonal method, then the non-hormonal IUD would be the best choice for you. So it's important to kind of think that for yourself and think about how you feel about that. As far as how do these go in and where are they going in? So this one, the non-hormonal IUD, kind of gives a little sample of, and I'll put it up there. This is supposed to represent a woman's uterus right here, and this would be the vagina. So the IUD is something that is in the uterus where a baby would grow as well, just so you can have a visual that this IUD is not something that a woman could just feel, a woman can't put in herself or take out herself. It's something that a provider would do in the office. So the procedure itself is probably less than 5 minutes. It's more prepping, talking to you, counseling you, and getting everything ready. I'm not gonna lie, it can be uncomfortable and painful. Just saying that right off the bat. I have put in several hundred IUDs, and I always like to get the feedback of all women's experiences, and it's very interesting how different they are. One woman could have a very severely painful experience, and another woman could say, oh, you know what? It wasn't that bad. It doesn't have anything to do with your age, how many children you've ever had. It's really a matter of your pain tolerance. So some women just have higher pain tolerance than others. There are certain things that could help minimize the discomfort you feel. So I strongly recommend that if you're considering getting an IUD and you're going to be setting up an appointment for the insertion, that you are taking ibuprofen, 400 to 800 milligrams, so a non-steroidal anti-inflammatory that you take about an hour before. It's really important that you're taking that with food, and by doing that it kind of helps take the edge off and helps with the cramping and discomfort you may feel with the procedure. To help, and I really do notice a difference. So I strongly encourage that, unless you have a contraindication. You know, you always want to double check with your healthcare provider that it's safe for you to take a non-steroidal anti-inflammatory, but you know, that's just an over-the-counter anti-inflammatory that most people can have as long as you take it with food, and again, about an hour before the IUD insertion is recommended. Now, most women will describe it to me as an intense cramping that lasts less than a minute and then subsides. Some women will feel crampy the rest of that day after the procedure is done, where they just kind of want to lay low, relax at home, and they feel like they have bad period cramps. And I've had other women tell me they went to the gym after their appointment and went on with their day without any issues at all. So it really varies. Other things to keep in mind is that you may hear from your provider that they want you to come in with your next period for the IUD insertion. And yes, this is something that's recommended because it can make insertion easier, a little bit smoother, and we are certain that you are not pregnant. It's very important that we are certain that you're not pregnant before the IUD is inserted, because we're going inside your uterus. So that's why there will be some providers who may say, I will not put in the IUD unless you're on your period. The problem with that is sometimes it's hard for timing, right? It's hard to time when you're going to get your period, that you're free and available, and that the provider is available to insert the IUD. So the other things to keep in mind is if you're planning to get an IUD, that you want to make sure you're having protected sex for at least 2 weeks before the IUD insertion if you're getting the IUD in on a different day other than your period. By abstaining from sex or having protected sex every single time, throughout the whole time, for at least 2 weeks prior to the IUD insertion, we can be certain that then when we do a pregnancy test before the insertion, if it's negative, that you are not pregnant and there's no question of an early pregnancy. So it's something that you will have to have a conversation with your provider to see what is best. Now, I will say that usually when a woman is on her period, the insertion itself is smoother and a little bit easier. So it's something that if you can schedule it with your period, that's preferred, but if you can't, that's okay. I don't want, it's a barrier when you're canceling your appointments and you're trying to time it perfectly, when there's a lot of different factors you have to consider, that it might not be feasible to do it on your period. So something, again, to talk with your provider about in the office. This video is to help you make informed decisions and have a good conversation with your provider where you're participating in your care, right? That is the most important thing. And that's what I think is lacking in healthcare today. I have so many women that just aren't sure about things that directly affect their bodies, and it's so important for you to know. There is no perfect method for everyone, although the IUD is one of the preferred methods now that's recommended, because there's no room for you as the patient or the individual to make an error, meaning you can't forget to take a pill or coming into the office or picking up your refill at your pharmacy. Once it's in your body, it is good for the amount of years that it says, depending on which one you pick. So it's many times referred to as a set it and forget it method. It's there, it's set, nothing you have to worry about to remember to do something in order to make it work. So because of that, it's considered one of the most effective forms of birth control, and it's a great option for spacing out children if you know you want other children in the future, but you're just not sure yet to do that, and you're busy being a mom and don't want to think about taking something every day. It's also a great option for young women who are in high school, college, and just really want to focus on their academics and their career, and pregnancy is not in their plan. It's a great option. It's completely reversible, meaning as soon as the IUD is removed from your body, it is possible to get pregnant right away. There's no delay to fertility. There's no reset period. I hear that sometimes. So just know that if you do want to get pregnant after the IUD is removed, it's pretty much fair game once you start having unprotected sex after the IUD is removed. Now, I will caution that depending on how old you are when let's say you have the IUD removed and you want to start trying to have children, if you are over 35 years old, there are other factors that can affect your fertility when you're over 35, and depending on your health overall, medications you're taking, all of these things can play a role too. So, many times I hear women say, oh, well, I was on this method and then I tried to have children and I couldn't, and they blame it on the method itself. There's really no data that says that there is any damage to your fertility with really all birth control methods. So it's important. There's other factors that can impact your ability to get pregnant. So just something to keep in mind, but overall, the IUD is very safe, it's very effective, and removal is also very easy, done in the office, really not painful at all. It's a weird sensation, but it is not something that is painful. So I really hope that this kind of helped make some clarifications. Whenever anything is inserted into the body, there's always risk for infection. So the procedure itself is done sterilely to minimize that risk. There is also an increased risk for an ectopic pregnancy, where the pregnancy could be outside of your uterus if you were to get pregnant. Now, to put that in perspective, it's 99% effective, remember I said. So there's less than a 1% risk of getting pregnant. But in that 1%, there is a slightly higher chance of it being an ectopic pregnancy, because the pregnancy would not really be able to implant inside the uterus since the IUD is there. So again, very unlikely a pregnancy, but slightly higher risk that if you were pregnant, that it could be an ectopic. Again, everything has its risks and benefits, so it's important that you kind of decide for yourself what fits best for you in your stage of life right now. The other risk is the IUD coming out. For whatever reason, some people's bodies do reject the IUD, meaning the body kind of pushes it out. So typically that comes with different signs and symptoms that are occurring, whether that's prolonged bleeding, heavy bleeding, severe pain, that your uterus is almost contracting to push out the IUD. The most common time for this to happen is in the first few months. The more time that goes by, the less likely that is to happen. The third risk that can occur is a hole poked in the uterus, or perforation, as the medical term is. And this is probably the most common thing, that if women hear anything about the IUD, they hear about this. Whether usually from Google, that has this horrific story where a woman had her IUD put in and it got lost in her body and ended up in her abdomen. That is a very extreme scenario. Yes, it is possible, but it is very low risk for that to happen when you're going to an experienced provider who puts in IUDs. So when the IUD is put in, there is a small risk, a less than 1% risk, of a hole being poked inside the uterus. Usually this has to do with either the provider not being experienced or the insertion itself being done forcefully, which is really not something that is recommended at all. So again, important to have a conversation with your provider about this. Make sure that they do have a lot of experience inserting IUDs. So if in the event that there was a perforation that occurred, in theory, the IUD can migrate out of the uterus and into somewhere else of the body. But this is a very extreme situation that really happens very rarely when going to an experienced provider. There are strings. I don't think I showed this before. So this is, again, a sample of one of the IUDs, and there are strings that hang out of your cervix. They get softer with time. This is not something that a woman would see. It's not like a tampon string that you would see. It's much higher up inside, but when it's time to remove the IUD, this is actually what the provider will grasp and remove. It is recommended to check the IUD strings every month. Some women feel comfortable with that, some women don't. But by doing that, you know that the IUD is in your uterus and it's not anywhere else in your body. Also, when you go in for your annual exams, the provider will be checking to see that they visualize the IUD strings. So if for any reason they did not see the IUD strings, they usually will order a pelvic ultrasound to check and make sure that the IUD is correctly positioned in your uterus. Sometimes the strings will shorten if they were cut too short when the insertion was done. This could play a role of why the IUD strings might not be seen, but it's something that usually is not a huge issue as long as it's confirmed under ultrasound. So again, that was kind of my spiel with IUDs. I really hope that you enjoyed this video and took something out of it, and something to consider. If this sounds like might be a good option for you, definitely feel free to comment below if you have any other questions on topics you would like me to talk about. I also just want to do another disclaimer. I am not at all replacing your one-on-one with a healthcare provider in person, but now you have the tools to go into that visit and have some more information when you're making the choice of what's the best birth control for you. Thank you so much for watching. Again, please comment below what you liked, any questions you have, and don't forget to subscribe. Thanks so much. Till next time.